Welcome to It's Your Case, presented by VetCT.com. I'm Heather, your radiologist on demand for this week. Today's example is a 7-year-old cat adopted as a stray. He presents for acute unilateral epistaxis. Once you have reviewed the radiographs, then you're ready to watch this video. Now, I think we can all agree, skull radiographs are one of the harder things that we do in veterinary medicine, especially within the realm of imaging. I'd like to start by using the VD view. Whenever I have a set of skull radiographs to assess, the first thing that I do, although this is true for all images I look at, it's especially critical for skull, is I assess how much obliquity is present. In my opinion, on this VD view, I see a decent amount of obliquity. What am I looking at to make that determination? If you look at the width of the mandible here compared to here, you can see that there's obliquity. There's also difference in the position and the size of the zygomatic arch here and here, as well as difference in the mandibular ramus. So once I know that I have some obliquity to deal with, I take that into account for the findings that I subsequently notice. In this case, I see a difference in the opacity between the right side of the nasal cavity, which I'm outlining here, and the left side, which I'm outlining here. The key to this case will be how much confidence can I put in this observation given the obliquity. So, using the nasal septum, which is here and is relatively undisrupted, I can see that on the right side of the nasal cavity, especially here I can see without being superimposed and here, that there's a general increase in opacity. So I'm comparing, for example, the opacity here and here to the opacity here and here. The next question is that pathology, such as fluid, mucus, or other pathology in the right nasal cavity, which could certainly fit with the clinical signs of right-sided nasal discharge, or is this due to superimposition and a little bit of obliquity is having a big impact on the resulting opacity of that portion of the nasal cavity? The next thing I want to think about, and I have essentially the same thought process, is in addition to that difference in opacity, one could also say that we observe lucency in this region, and especially what I notice is that when I trace the right mandible, I can trace it really well, and when I trace the left mandible, I start to lose it about here, where I've put the arrow. So now I'm back to questioning, is this because there's obliquity? We already talked about the mandibular position being one of the ways we can tell there's obliquity on this series. Or is there pathology here, something causing bone lysis? Especially when it's centered at the root of the tooth, as it is here, I can be concerned about something like osteomyelitis secondary to tooth root abscess. Whether it's a skull radiograph or any other body part, anything that I see on one view, I always want to corroborate using other views. The challenge with skull radiographs, and the reason we all find them so hard, is it's almost never possible to get the areas that we're interested in without having lots of other stuff superimposed. So if I wanted to use the lateral view to help me assess the opacity of the nasal cavity, because the nasal cavity between right and left sides is superimposed, it's much harder for me to make a conclusion. I would say that I have the general impression that there is some lucency down here, but I don't think I could say anything more than that. And certainly there is some dental disease and even some absent teeth in this arcade. When it comes to skull radiographs, a reference that I find helpful is this one here. This is by Mahoney from the Journal of Feline Medicine and Surgery in 2012, and it shows various views and explains how to obtain them. I have to admit, when I'm concerned about skull disease, I virtually always recommend a CT, pretty much regardless of the species. So, my conclusion on this case is that I'm questioning increased radiographic opacity in the region of the right nasal cavity, and I'm questioning decreased opacity and disruption of the left rostral mandible. Differentials for this, as I said, could be non-specific rhinitis and possibly a process such as osteomyelitis involving the tooth root. Be sure to review the full report associated with this case. Thanks for listening, and remember, it's your case, so please post your questions on social media.